I think one of the most important things as well is early mobilization. So patients come into the ICU, if they're bedbound, each day their risk for developing worsening ICU-acquired weakness increases, and these patients, they're often agitated, sometimes in their restraints, and what we want to do is wake these patients up a little bit, get them sitting on bed, working with our physiotherapists, and getting these patients starting to walk. And there's a landmark study from Schweikart and colleagues 3 years ago in the Lancet where they took people that were, active, they weren't bedbound before they came in the ICU, and gave them aggressive early mobilization. It decreased delirium and got them out the ICU faster. And probably the most important thing is that it changes the trajectory of the patient outside the ICU. So rather than these patients going to a nursing home or an LTAC, they actually get the patient back to where they came from. And that's critical to patients and their families. No, if you talk to any elderly patient, it's their worst nightmare to end up in a nursing home when they're living at home in a house and having an active, enjoyable life. So again, this is non-pharmacologic stuff.